question. So query from Shirpur, Nashik, Maharashtra, lower patient conversion ratio. It only comes from primarily your low confidence in your skills. If you are not confident of your skill set, you will surely not convey it with conviction to your patients. The moment they ask you for a before and after, you will falter and flutter. And if that is happening, that means you lack in those skills. Nothing wrong. Awareness and identification of a problem is the first step. Understand that you lack in this, acknowledge that, accept it, make that as a learning goal, seeko. Once you have a confidence over that skill, you will automatically have the confidence of selling it also. प्रैक्टिस उस चीज की जाती है जिसके लिए आप जानते हो लेकिन बोलना नहीं जानते. लेकिन अगर स्किल में कमी है तो फिर प्रैक्टिस ऑफ द स्किल में कहीं ना कहीं फंस जाओगे आप. 50 to 60% overall partly maybe due to not panicking the patient, as in a tier 4 city, most patients just want medicines for pain relief. If I try to convince more than they doubt, so I use push phenomenon, and so maybe the less conversion ratio. These are the numbers that are a figment of your imagination. 50 to 60% you are making a figment of your imagination. It does not work that way. If they want medicine, because you have not been vocal enough to create the awareness of saving that tooth, of equating the same to a body organ, of creating a sense of urgency in their mind that this treatment is needed. It's simple. 2 new clinics coming up with further decreasing the footfall. Not worried about the discounted charges or about the competition, just worried that some patients may opt them by just comparing consultation charges. How many people actually do a window shopping in case of healthcare? Not even 10%. That is, I don't say it. It is the data all around the net. And Indian data, not you can say. 10% लोग सिर्फ rate compare करते हैं. And those are C category convenience patients. What we have made a hue and cry is clinic में आते ही patient वो है जो rate के लिए करता है. As if people are not worried about their health. Open up social media, open up Facebook, see cases people are doing. Full mouth implants, full mouth treatments, full mouth kind of treatments. So many things. 2-4-5 हजार में तो नहीं कर रहे हैं ना. 5-6-7 लाख में कर रहे हैं. और हम लोग सिर्फ 1000-2000 की चिंता में डूबे बैठे हैं. Get real. 2 क्लिनिक की जगह यहाँ पे 20 क्लिनिक भी खुल जाएंगे ना. कंपटीशन नहीं बढ़ रहा. आबादी भी उतनी स्पीड से बढ़ रही है. एक साल में 5 डेंटिस्ट खुल जाएंगे. एक साल में आपके एरिया में 5 लोग नहीं बढ़े, 5000 बढ़े होंगे. इस स्पीड से पॉपुलेशन बढ़ रही है अपनी. डेंटिस्ट बढ़ रहे हैं ना. आज तक 3 लाख ही हुए हैं आजादी से लेके अब तक. 3 लाख ऑफिशियल नंबर है, लेकिन आजादी से लेके हम उस वक्त 30 करोड़ से 150 करोड़ हो गए हैं. डोंट लुक एट द नंबर ऑफ टाइम, सी द नंबर ऑफ वॉल्यूम. तो स्टॉप गिविंग दीज एक्सक्यूजेस ऑफ न्यू पेशेंट. वो करने चूज करने दो. वो कर रहे हैं चूज करने दो. आपको लगता है जो फुल माउथ कर रहे हैं, क्या उनकी कंसल्टेशन फीस 100 रुपए होगी कि 50 रुपए होगी कि फ्री कंसल्टेशन का कैंप लगाया होगा? नहीं ना. They just targeted the A and the B. They are not bothered about C and D. Why are you bothered? Costly dental equipment such as OPG, CBCT, scanner, laser, as I have every basic equipment, upgrading to advanced equipment is a concern, as patients here don't understand the importance of having them. Patient के understand करने से पहले you have to understand whether those are needed with you or not. Costly dental equipments are not a showcasing of your facilities or a showcase of your facilities. They are basically meant to give you enhanced revenue in bargain. The return over investment is the first thing. So पहले देखो उस चीज के लिए आपके पास patient भी हैं कि नहीं हैं. One of my friends is opening up a clinic very soon. He's actually having a clinic more than you can say mine. You can say mine is 24 years old. His clinic is 26 years old. He's a few years senior to me. He's building up a new clinic, and he asked me about the specifications of the OPG and everything. I gave him that. I said, "Are you buying it?" Said, "Dil to bahut hai, lekin when I listen to you, I get fearful कि तू दो गालियां सुनाएगा मेरे को." Why? I said, keep a provisions. We are renovating clinic in a different space or making a new clinic in a different space for his son and daughter. Fair enough. Make those. Keep a provision, but don't buy it. Because the place where he is constructing his clinic, 100 मीटर पे शहर का सबसे बड़ा OPG center है, जहां पे 80% of my city OPGs go. And it is a wonderful center giving a good, you can say, good diagnostic output with no compromise whatsoever. Charges की मैं बात नहीं कर रहा हूँ. Charges तो सबके almost same ही होते हैं OPG के, किसी के 50 कम 100 ज़्यादा. That is absolutely okay. And anyways, the patient has to pay. But keep a provision, but don't buy it. Don't buy it. Because you need to understand the return over investment for that. So that is one part. You understand where your clinic revenue is coming from. That is another part. So if you are not knowing where are your patients coming from, शायद आप काम कर रहे हो, denture work कर रहे हो, शायद आप काम कर रहे हो, root canal का काम कर रहे हो. What will be the scanner useful to you in that regard if you don't have that much amount of implant or crown and bridge cases? So understand where the revenue is coming from. That is going to help you a lot.